Is there anything you should avoid while taking Zepbound? Absolutely. And knowing what to steer clear of can make a real difference in how well your treatment goes and how you feel along the way. So let's talk about why this matters. Zepbound is an FDA-approved medication for chronic weight management. It works by slowing down how quickly your stomach empties and reducing your appetite. That's great for weight management, but it also means your body is more sensitive to certain foods, medications, and habits than it might have been before. Let's start with food, because Zepbound slows gastric emptying. High-fat and greasy foods can make side effects like nausea and vomiting significantly worse. Think fried foods, heavy sauces, fast food. Those tend to sit in your stomach and cause problems. Large portions are also worth watching. Your stomach is processing food more slowly now, so smaller, more frequent meals tend to be easier to tolerate. Spicy foods can also trigger symptoms for some people, so it's worth paying attention to how your body responds. Alcohol is another one to be mindful of. It can worsen gastrointestinal side effects, may affect your blood sugar, and heavy use may increase pancreatitis risk. It's worth having a conversation with your doctor about what's appropriate for you. Here's something really important. Don't swing too far in the other direction either. Because your appetite is reduced, it can be tempting to eat very little, but extreme caloric restriction isn't the goal. Your body still needs adequate protein and hydration to prevent nutritional deficiencies and muscle loss. Even when you're not feeling hungry, try to make sure what you do eat is nutritious and that you're drinking enough water throughout the day. Now let's talk about medications and supplements. Zepbound should not be used together with other GLP-1 receptor agonists, other tirzepatide-containing products, or any other weight loss medications. These combinations are not recommended per labeling. If you take insulin or sulfonylureas, your doctor may need to adjust your doses because combining them with Zepbound can increase the risk of low blood sugar. If you use oral contraceptives, the FDA label advises considering a backup contraceptive method when starting Zepbound and after dose increases, since changes in gastric emptying can affect how those medications are absorbed. Ask your clinician what's right for your situation. Always let your healthcare provider know everything you're taking, including over-the-counter products and supplements. And if you're pregnant, planning a pregnancy, or breastfeeding, make sure to discuss that with your doctor before starting or continuing this medication. One more important thing, Zepbound carries a boxed warning about thyroid C-cell tumors observed in animal studies. Because of this, it's contraindicated in people with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2. If either of those applies to you, that's a critical conversation to have with your doctor. When should you reach out to your healthcare provider right away? If you experience severe abdominal pain, persistent vomiting, vision changes, or any signs of an allergic reaction, like swelling, difficulty breathing, or a rash, seek medical attention immediately. Also, contact your doctor if you notice symptoms of low blood sugar, or if you're struggling to eat or drink enough due to side effects. Let's recap the key takeaways. High-fat foods, large meals, and alcohol can worsen side effects. Smaller, balanced meals tend to work better. Don't combine Zepbound with other GLP-1 medications or weight loss products, and make sure your doctor knows everything else you're taking. Keep up with protein and hydration even when your appetite is low, and never hesitate to reach out to your healthcare provider if something doesn't feel right. Everything in this video is for general information only. It's not medical advice. Please speak with your doctor or a qualified healthcare professional for guidance specific to your health and treatment plan. If you found this helpful, drop a comment below. We'd love to hear what topics you want us to cover next. And if you haven't already, give this video a like and subscribe so you don't miss what's coming up.